Howdy folks, High Value DMD. In this video, I want to talk about this topic. Medical school is easier than dental school. Yeah, I said it and I'm going to get into it. If you're watching this video, please let me earn your subscription. Don't just give it to me, but let me earn it. Leave a comment, let me know what you think. So I said it. I think medical school is indeed easier than dental school. Why do I think that? Well, in my experience, dental school, you have to do more than just take exams and go to class, okay? We have simulation lab where we have to actually in person use a drill and focus on our hand skills and be able to identify things. We have to be able to shape things on a tooth looking backwards and upside down. And so you're learning all of this simulation activity while you're taking your basic core classes. For medical school, essentially, you go to your classes and you listen to the material, you go home and you study the material, and you do that over and over, rinse and repeat, and you take exams. In dental school, we also do that, but we do all of this extra stuff. Now, I will say, I do think medical school curriculum definitely is different. Dental school, depending on the dental school you go to, if you go to a dental school that is taking the same classes with medical students, then it will be the same material, it will be the same difficulty. But if you go to a dental school that isn't affiliated with a medical school really, with their curriculum, the basic sciences won't be as hard. It will be more to the point. You will learn pharmacology, you will learn physiology and all of that, but it's not going to be necessarily catered to taking the United States medical licensing exam like the medical students take. Medical school, you have much more pathology. It's a lot deeper. And for me, that would be like a huge heavy hitter. And I would also say anatomy classes are going to be much more serious and in depth. In dental school, more or less, we take the upper half of the body, like the waist up. Medical school, it's the whole thing. Usually, a medical school has a cadaver lab where you dissect a corpse essentially and identify all the structures. Not all dental schools have that anymore. They used to, and some still do, but mine didn't. And I regret that my dental school doesn't have that, because I think that's very beneficial. So while, and I will say, it seems like medical schools typically have more time off. I say that with hesitancy, because there are some dental schools that have time off, but at least in my case, my medical counterparts, my friends that I've called at other schools around the country, they say how they have summers off, they have this time off, they have a dedicated time to go study for board exams and all of this. We do not get that in dental school. No, sir, we don't. So first 2 years, we're doing our simulation lab, and then we're taking our core classes and all of that, and we don't get much time off. My school does not have it has one summer off, but it doesn't really typically have summers off. And so then once you walk in a clinic third year, you are taking care of patients entirely yourself. You are the front desk person. You are the schedule coordinator. You're the finance person. You're all of these positions, and you're the dentist. And you have to treatment plan and understand all these things. You got to juggle your patient roster. And you have to do procedures to graduate. If your patients don't show up and you don't get your requirements done, in theory, you may not get to graduate. It's like if I were to tell a medical student, hey, if you don't observe and remove so many gallbladders, you're not going to graduate with your medical degree. Pretty crazy, right? That's how dental school works. And so, we do clinic, and we don't get time off for our board exam. We have an international dental board examination, and that's in our fourth year we take it. And we've got like 3 other parts to our licensure that are in person, that you have to do like on a person, for like on a tooth essentially, on a person. But now it's not necessarily a live patient exam. It used to be. So we have to do that. And I understand my medical colleagues, they have USMLE part 1 through 3. So that's, but at least for part one, I know a friend that got like 6 months off to go study for that. We don't get that. We don't get that. And I don't think the INDBE, my board exam, I don't think it will be as hard as the USMLE, but we don't get time off for it. You just go home, you study in the evenings, and you get up, you get to the clinic at 8 o'clock, and you start work. In those ways, I think it's harder. And then you add on top of this, imagine if you wanted to do all of this in dental school, and then you wanted to do oral and maxillofacial surgery residency. Then you have to simply find time in your schedule to go and study for the USMLE on your own time. And imagine if you didn't go to a dental school that adequately prepared you for that material. You learn it yourself. There's nobody that's going to be there to teach you it. You learn it yourself. So I think for these reasons, and the last reason I'll say is when you leave dental school, you are a licensed doctor. You're out in the world. You are responsible for yourself and your patient care. Whatever you do, you are liable for it. Like, that's it. You got to know the material. You got to know how to do it. So it's a different kind of philosophy. You graduate earlier and you just get to work faster. And with that, it comes extra responsibility. So anyway, if you agree, disagree, just let me know in the comment section. Like I said before, let me earn your subscription. As always, stay hustling, folks.